Good evening. Welcome to a Cumberland County Workshop. I'm Neil Jamison, Chair of our County Commissioner Board. We have a workshop agenda for everyone tonight. Prior to doing that, if those of you who want to join me, pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item on the agenda tonight is the consideration of Community Corrections Center lease. Jim, do you have any intro comments?
Yes, thank you. This evening you have before you a proposal from Hope Acts and Quality Housing Coalition for the opportunity to house upwards of 20 asylum seekers who are expecting or had just given birth. This is an opportunity for them to consolidate asylum seekers who are pregnant into one area so that they can focus on providing services to those in one setting versus multiple settings. In your packets this evening, you have an outline of the questions and answers that were passed back and forth between staff and Hope Acts and Quality Housing Coalitions, and they have been, as of middle of last week, updated to the fullest extent. Some of the questions that I'll leave you with as we work through this, one of them is staffing of the building. It is, right now, they're seeking a little bit of guidance on what our desires would be. I can add that in conversations with staff, we would ask for a 24/7 staffing model. Parking, the need for parking, and because it is very limited down at the site, it's actually adjacent to the building and on a dirt road. And as of last week, the proposal had been amended, and hopefully we'll learn more about what they're thinking. And that is, they want to have an opportunity to not only have those females who will be given birth at the facility, but also any asylum seeker that might have a medical condition that would warrant medical treatment, and they would like to have the opportunity to kind of add that as a use within the 20-bed setting. The fourth is around the same time, middle of last week, there was an announcement from Maine Housing that CHOM, which is a local housing developer in the greater Portland area, just received $2 million from Maine Housing for housing for pregnant females. I guess a question that we would have is, how does this fit into this proposal? Are they different, or are we aiming for the same population? One question that the staff brought up was the length of visiting hours during the day, as there was the majority of the day could be of visiting hours, and we raised some questions around activity in that building, because, as we all know, that building sits right at the entrance drive to a very busy campus that not only supports the jail but also law enforcement center. We have not finalized liability insurance. I know that they have been very actively speaking to an insurance carrier. We just haven't seen anything. That's not abnormal, but I just wanted to make the commissioners aware, because there's been a running history of liability insurance and that being acceptable to the risk pool. And then lastly, we have to remember that this is a jail complex that is bringing law enforcement, visitors, and detainees onto the site. Again, the building sits right at our curb cut, and the use of the building shouldn't impact campus operations or put users of the building in harm's way. So I just wanted to bring those items out as items that not only Hope Act and Quality Housing may address in their presentation after I'm done talking, but maybe questions that the commissioners want to follow up on and dig a little deeper into. So thank you for the opportunity.
And we have someone here from Hope House who would like to flesh out their updated request and background information.
Sure, Victoria is actually Quality Housing Coalition, so she'll start.
Welcome.
Hello, how are you? Thank you so much for having us here, and I'm Victoria Morales, Director of the Quality Housing Coalition. I'm here with Martin Stein, Executive Director of BOCC, and with Marion Johnson, the Director of Prevention at Maine Health and Medical Center. Just to start out, and thank you, County Manager Gailey, we want to just express our sincere appreciation for going through these steps with us and really envisioning a way that community can work together with the county to solve, partially, right, because this is too big to solve in just one project, but to solve a really big problem that we're having with unhoused asylum-seeking women who are pre- and postpartum with medical needs, and also asylum-seeking women who have medical needs and need of a respite. And what we just want to share with you all is that we are envisioning the space not as housing. We're envisioning it as a respite. It's not permanent because the space is limited and we have toured it. It's not a place where people will stay for very long. They will stay as long as medically they need to stay to either prepare to go in to receive care. So I'm imagining women who have high blood pressure and they're very pregnant, but they're sleeping at the shelter next, inches away from other folks in a shelter situation. So we just want to thank you for allowing us to go through these exercises together and really think about what could be in this space. Tonight we want to talk to you about the process so far, where we've come, and present to you from Maine Medical Center and Maine Health the need on the ground today and some of the experiences and the data on the ground that they are seeing and why this project is very important for them. Gateway Community Services is also a organization that is supportive of us moving forward with this project. They cannot be here tonight. And I'll speak as well, after I do the timeline, to the CHOM proposal for the Mercy Hospital health bed asylum-seeking women's unit that's being developed. So just as a timeline, we began talking with the county manager around November about the use of this space. We then had a tour of the space, but prior to that we came to you, and that was December 12th. And in constant communication with the county manager, we heard from you on December 12th that one of those biggest issues was insurance, was liability, was risk, was indemnification. We heard that loud and clear, and we devoted that next period of December and January to solving that issue with our insurance carrier. The insurance carrier is Clark Insurance. They came to the site on December 22nd when we toured it. We also brought our Director of Programs, Rod Mella, who has been receiving calls from Maine Medical Center from social workers who have no place to discharge asylum-seeking women who have given birth to. In January and February, and moving into March, we worked with our community partners at Maine Medical Center, Maine Health, and Gateway Community Services to really define what this program could look like, as well as respond to back and forth with the county manager on questions and fine-tuning in preparation for coming to you today. We will resend the insurance quote that we received, but it was much less than we all thought. It was in the $3,000 range to add to coverage that BOCC already has, and Martha Stein can talk a bit more about that. And I'll just briefly address the CHOM proposal. That is, I sit on the board of Mercy Hospital, and it's a fantastic proposal that would create 12 units of permanent housing on a piece of property that the Sisters of Mercy own out on Capissic Road. It will then, after being used for a couple of years for this purpose for asylum-seeking women who are at Mercy Hospital and being discharged, they will have a place to stay. And then after 2 years, it will become permanent housing under the low-income housing tax credit program. So it's a wonderful program. If it were to provide more space, maybe we wouldn't need to go forward with something like this project, but it is very limited in that it's only for 12, and there is need for others in this short-term timeframe. So just before I turn it over to Maren Johnson, who's the Director of Prevention at Maine Medical Center, I want to just add that Quality Housing Coalition part in this project really is to work on supporting folks with that transition. So providing the community services, whether it's behavioral health care or community health workers, making those connections to the health care that the women are receiving, and then making that transition from stay at the space to their next space, whether that be permanent housing, and we do prioritize women with emergent medical needs, or whether it be back to a shelter space. If anyone has any questions, I'd be happy to answer them.
No?
No?
Thank you very much.
So Maren Johnson?
Good evening, thanks for having me. So, as Victoria said, I'm Maren Johnson. I'm the Director of Prevention Programs at Maine Medical Center's Preventive Medicine Enhancement for Maine program. So it's a little small program within Maine Med. During the pandemic, we developed a community health worker program, which I'll just refer as CHW. It's called the Community Informed Care Initiative. This is a community-based program that's responsive to medical, social, and environmental needs of the new immigrants in the greater Portland area. Our program responds to the specific needs of disenfranchised communities and helps individual patients navigate the complex healthcare system while trying to meet the demand for primary care access, transportation, food, clothing, and housing. We are working as hard as we can to meet the medical needs of our patients that can't be met in the shelter, and our CHW tries to focus on health needs, concerns, access to primary care, and setting health goals while adhering to any provider care plans. But the primary concerns in conversation always comes back to the social determinants of health. Really, it's been primarily housing. So this project came on at a great time for our community health worker who is out there in their community trying to serve immigrants in healthcare, and they have no place to live. And especially when she's working with pregnant mom or postpartum moms, that fear of having no place to go with their child is exasperated. And especially, and add to that if they have other health concerns going on. It's really been heart-wrenching for our CHW and for our team to have to be face-to-face with a new mom with a newborn, and there's no housing available after delivery, or to see him struggle in the shelter, navigating back and forth between shelter and the church to sleep and to eat. Our best case scenario, which is still not ideal, to send him to a hotel, which is not going to be an option in April anyway. We are also fortunate in our program to have our preventive medicine fellows that are our clinicians in a preventive medicine fellowship at Maine Med to serve as clinical support for our CHW to make sure we're accessing the right clinical services for the patient. There's so much you can do when you have to tell a high-risk or late-term pregnant woman that's been sleeping on a mat in a shelter, or to send a newborn into a shelter just after being born. I mean, she just tells me the stories, and I, turn my Zoom camera off because it's very emotional to hear that. So I can't imagine being on the other end, face-to-face, of having there's nowhere to go right now. So this respite center is a temporary but promising site to help these patients and really keep people alive. Our CHWs will continue to serve the people staying at the respite center to help them heal, to educate them on community and clinical services, and provide them resources to prepare for a more permanent situation to come. Our goal with the advice from our fellows would be to help them heal properly, help the baby grow, and understand their medical needs and care plans so they are ready to search for a family home. Thank you.
I have a question. The children that are born at Maine Health or Maine Medical, are they United States citizens now?
Are they United States citizens? So they're born in the United States? Yes.
Right. Thank you.
Any other questions?
No? I'm going to save my questions till I hear everyone. That's okay. First off, I just want to thank you for your commitment to public service. My name is Brian Batson. I work at Maine Health in Government Affairs. I'm a RN and a former city councilor, so I understand this can often be very challenging and thankless work. So I'm here tonight to at least start off by saying thank you for your work towards this. So like I said, I'm here on behalf of Maine Medical Center and Maine Health to express support for providing safe shelter for unhoused women and their infants. We're currently seeing firsthand how imperative this project is to support women and infants in our community. At Maine Medical Center, we have seen a profound influx in unhoused new Mainers. In the month of December, one full-time social worker supported 40-plus women that were supported in their housing by general assistance and other community social service agencies. With legislative funding ended for the local hotels, these women are faced with the uncertainty of where they and their infants were going to sleep at night. This program would be able to support women and infants in their prenatal and postpartum period find safety and stability as they navigate their new community. From an inpatient setting, pediatric social workers are given a relatively short window of time to provide. I'm waiting for my phone. I wish I had printed this out later. To provide them with basic social determinants of health. In 24 to 72-hour period, these women and families are in the hospital. We are challenged to assess food, housing, transportation, continued medical care, and their connections to the community resources that they need. While what we are able to do for these families is life-changing, there is always more that can be done. We are fortunate to work with community partners to help support these women and their infants. We're lucky to have the support of Cradle Maine and the WIC program that can provide nutrition and public health nursing. With the supports of the Cribs for Kids program, we're able to provide a safe sleep environment. Lastly, due to philanthropic funds at the Barbara Bush Children's Hospital, we're able to provide 1 to 2 outfits and a car seat to each and every newborn. While all these things are imperative for children's safety, we're unable to provide shelter for these incredibly vulnerable infants and their mothers. As you know, MMC and Labor and Delivery serves local families, but also high-risk women and infants from across the state, as well as the state of New Hampshire. Due to the lack of transitional housing, many of these women can spend several extra days in the hospital that are not medically indicated. With an overwhelming census and a constant demand for hospital beds, unfortunately they can be occupying beds that are desperately needed by other people. Providing some of these women and infants with the opportunity to benefit from the services of the Joyce House will impact the trajectory of their lives and the lives of those around them. Basic human needs are needed by all, but unfortunately a barrier to many. We are fortunate to have an opportunity to help change that by supporting the Joyce House. I'll also add, I'm a new father myself, so happy to be here on behalf of Maine Health, but it's also very personal to me having a 1-year-old who turns 1 in 2 days. So thank you for letting me speak tonight. I appreciate your work on this.
Any questions for Brian?
I can't resist making note that he used to be my city councilor. I can't remember, as we sit here, who it is now, but I continue to wish it was still him. So, good to see you, Brian.
It's good to see you in this capacity as well. Thank you.
Good evening, I'm Martha Stein, I'm the Executive Director of BOCC as one of the lead partners in this proposal with the Quality Housing Coalition. We have been providing housing for new asylum seekers for 10 years in our building, which is called Hope House on Sherman Street. And we also support numerous individuals and families in the community. Our focus is really 100% new asylum seekers to the state. This morning, Director of DHHS for Portland, Kristen Dow, shared with all of us that 900 asylum seekers have arrived in Portland since the beginning of the year. That is remarkable, and it is it's a federal issue, it's a state issue. It is. I certainly don't have the answers. What I do know is that working with Victoria and her team so closely over the last couple of years, we have provided housing for many individuals and many families. At the same time, in addition to new moms, I have also received calls from the hospital example, an older woman, she needed, not sure what kind of surgery, it was on her leg or hip or something. She needed it very badly. She was in excruciating pain. The surgeon would not operate because there was not anywhere for her to recover because she was in the shelter. So she was prioritized, we got her an apartment, and she was able to access the healthcare she needed and move to a place where she could recover. We get calls from, like everyone here, from hospitals, from social workers, every single day. And in fact, I had a young lady living in my building at Hope House who is pregnant, and thanks to my partnership with Victoria's team, we were able to get them into an apartment. And I'm not saying we can do that for most people. So we have moved her, and her partner in this case is with her, but she was living with a couple other women, and we are not an environment suited for moms with infants. It's, you know, congregate living. So it's very hard, but it is very doable. I also want to say that the asylum seekers, you know, in my years at Hope House, which has been 5 as a director and 2 on the board, we don't have, I think we have at least called for our building maybe 4 times, and those were medical emergencies by and large. People are exhausted, they're stressed, all they want to do is rest, get their lives together, and move on. So it's, I know this is something very, very different in terms of the use of this building, but it would be such a wonderful help. And I know from my own experience and work with asylum seekers that you know, it should not be problematic. But we are also, you know, happy to, we want 24/7, you know, coverage. We can do that. We have a lot of flexibility in how we model the program, so all of you feel comfortable, and we can also be providing the best care possible. Happy to take any questions.
Thanks.
Questions?
Sure.
Go ahead.
Good evening. Thank you for your presentation. Thank you to all the folks who spoke this evening on this matter. I have a couple of questions around, I guess, just getting my arms wrapped around this, you know, giant issue we have here before us. You have 7 years, you mentioned, 2 on the board, 5 as executive director. Through your years, have you seen, what is the total amount of pregnant women who you're speaking of in this population base that is, how many women is it exactly? I mean, I understand that what we might have is 20 beds. What Mercy may have is going to be 12 beds. What is the population base that we're looking at?
I would have to defer to the main health folks.
Okay.
Because they would
Okay.
have much better information on that.
Okay.
I was gonna check my data before I came, and I didn't, so I can definitely look into that for
Okay.
you, unless you have delivery.
Honestly, I don't have them.
Okay.
But that's we can get that.
Okay, so I guess, you know, I asked a large-scale question because I just want a sense of, you know, how many lives will we affect? And of course, when you affect one life, it's enough, right? And just one person that you're trying to help. But I want to get a sense of where we fit in, potentially the county fits into the more global issue of, is it 150 women out there, and this is like a drop in the bucket, and where do we go from here? And I just wanted to get a sense of how we may or may not be a partner in making this a possible avenue. A question aside from once I find out what we're talking about is, how does this work in terms of length of time? So I've heard the word respite, and it's transitional. So it seems, you know, when do you cut it off? And even if you had this space for 1 year, what kind of impact would that serve after the year is done? And then, is it another reshuffling? Is it waiting for other programs to develop? I mean, is there a large-scale plan anywhere that's going to address this issue, which, knowing that 900 folks have come in as of 1/1/2023, if you know, in your realm of what you do, of those 900, is that going to be 10% are going to be potentially folks who are, you know, pregnant? And so when I look at that number, it kind of, it's concerning, because how big is this problem and where's our little piece in this big, big problem? So what would a year look like? Would that be a Band-Aid kind of approach? Yes? Okay.
Or try to answer.
Yeah, I mean, it's such a big question, and like I said, I don't think we can solve it with this project, but you know, as you know, there's no big solution to solve the housing crisis right now or the asylum seeking crisis right now. But there are a lot of amazing organizations working together with local governments to come up with solutions together. And I think this is something that could be replicated. I also think that this is temporary in nature in terms of the use of this space, and it'll give us the opportunity to evaluate it and see if it's working. And the fact that we have Gateway Community Services, which provides behavioral health services to immigrant populations primarily, as well as Maine Medical Center and Maine Health on their prevention side, means that we can do a lot more than were we not to have that deep connection with community. I'll also I'm trying to harken back to why we even came before you. It was back in December, and there were, I think there were, gosh, it was like 13 keeps coming to my mind, but there was something like 13, I can't remember the number. It was an alarming number, and I'll have to go back and look to my notes of how many babies had not made it, how many pregnancies had ended because the women were unhoused, and that was the reason. And had they not been unhoused, they would have made it. So this was a call to action, really, from the community and you know, Quality Housing Coalition. 60% of our population, of our residents, are asylum seekers. We have 250 units we're overseeing right now in 5 counties, and I would say the majority of those households have new babies.
Mm-hmm.
So you know, while we'll get those numbers for you, I think the problem is. The need is great. This will not solve the whole thing, but it will be a chance to try something, to innovate, and to create something that the community needs together.
Jim? Well, I'm sorry, Patty.
Just
follow
one,
up. Go
the
ahead.
parking, you know, I'm just looking at some of the notes that the county manager mentioned as well. I guess I don't, I mean, I have no assumptions. I don't really know the population well. So when, of those pregnant asylum women, how many of those have cars, or they have partners with cars? So is that like almost every, or only 10% have cars? Because it's really cool that they get car seats from, you know,
Good point.
that program, so.
Yeah, likely no one will have a car who's a participant.
Okay.
However, providers coming in, providing services, staff will have vehicles.
And visitors.
Visitors as well, and that's something we want to talk to you all about. You know, what would you allow for visitors? I mean, we think deepening and continuing connection with community as if is important for recovery. So we would love to be able to continue to do that.
And my last question is about staffing, and maybe some have other quick questions. Security-wise, I just think about, you know, just want to make sure people stay safe, and I know some places have security guards or people who are watching the door. I don't know what that staffing model will look like, where, you know, there might be people as a resident overseeing overnights, but is there also someone of a security nature there?
Sure. Yeah, so, you know, again, because we have flexibility, we hadn't envisioned a security guard type of model. I believe the doors are locked, and we would have visiting hours that would end at a certain time.
Okay.
And the staff that is on site, and there would be 24/7 coverage would would be responsible for managing that. I honestly, just from my own experience, I don't think people are going to try to be getting in after hours. And in fact, talking with some community members, for women who might have other children who are staying somewhere, whether in the shelter or not, they're going to want to be, discharged. It really is respite. They want to be there to rest, recover, and leave. They are not going to be entertaining. We've said that just I guess it's the dining room area, that's the only place where visitors could come, not into the bedrooms, anything like that. And we would manage that very carefully. We would also have folks sign an agreement with us, as we do in my building. And again, in my 10 years, I think we're actually going to hit our 100th resident this month. We maybe 2 times, I have had to tell someone they would be evicted if they broke the rules, and they're very motivated to not break the rules. Again, they just really want to recover and be back with their families or with their communities as quickly as possible. But I think we share the concern about security. But if the outdoors are locked, I feel pretty okay that it's as safe as any other environment.
Thank you very much. Thank you.
Thanks.
Jim?
I don't know if there's anyone who can answer this here, but I am quite interested in understanding the status of all these applicants for asylum and how they fare over the long term. I'm aware that we'll have one judge in Boston who's distinguished herself, if that's what we're going to call it, by having one of the lowest approval rates in the nation. And this actually concerns me quite a bit, just realizing and understanding that there are children who are citizens of Maine and the United States whose caretakers are likely to be entertained by her judicial wanderings. So do you happen to know in this population what their litigation status is heading into the circumstances they have?
Yeah, I mean, it's super complicated. So one of the things that my organization does is we started running at the public library. We run an asylum application clinic where people can come to apply for asylum. And for the past 5 years, we've been running a work permit clinic, and we work very, very closely with ILAP, which is the Immigrant Legal Advocacy Project here in Maine, which is the lawyers who do this work. The system is really broken for people who, but while they're going through the process, after they apply for asylum, they have to wait 150 days. They can apply for a work permit and then work. So cases are taking years and years and years, and you can talk to the congressional delegation about that. But people are working, they're paying taxes, they're renting homes, and they are living independently. The system is terribly broken, and nobody's called to ask me for my opinion on how to fix it, but it's not. And I don't know the answer. I know people who have been here for 6, 7, 8 years, and they haven't had their first hearing yet, but they're working. And I have asylum seeker staff members who have not had their first hearing yet, and they're amazing, productive contributors to our economy, to our community. There's lots of asylum seekers working at Maine Health. It's a great question, and there's not a good answer, in my opinion. Sorry, Greg, any?
Yeah, I had a general question as well, Marion. One of the issues that Jim mentioned in his intro is that the prospect of maybe medical conditions, people with medical conditions also being housed there. And that is a somewhat different set of needs than asylum women who are pregnant and about to give birth, because of the unknown of the medical conditions, the lack of any medical staffing there, and the costs that would be associated with that and the risk. So if someone could address any or all of those issues,
I'll just say, and then anybody else can chime in. So we will always reserve the right to decline if Maine Med calls us and says we want this person, to be considered for a respite bed in this space, we will reserve the right to say, no, that this. I've only, my only experience with having to be pretty firm no with people is I've had Spring Harbor Hospital and what is the Maine Behavioral Health? Just at Maine Med, yeah, Maine Behavioral Health. Want me to consider people for my building that are really, really seriously medically ill. Mentally ill, and none of us can do everything, and we've had to say, I'm really, really sorry, I can't take that on. So we will be smart. We're not going to, but we're also very close to Maine Med, and that's one of the reasons the location was, really great for what we're thinking about. But, we wouldn't knowingly enter a situation where anyone, we'd be putting that person or anybody else living there at risk. It's just something that we want to give ourselves a little space on. If there's 20 beds and we happen to have 2 available and Maine Med calls and says, this person doesn't need to be in the hospital, but they need a quiet, clean environment to recover for a week, we want to be able to say yes to that. But there's so many, we just don't know, but we're going to be really, really careful.
through your process, even before you came to us and during these last several months, have you sought funding and resources from, for example, the city of South Portland or the city of Portland through their ARPA funds?
Not for this specific project because we weren't far enough along yet, but that is obviously something that we would be fully responsible for, is finding the funding for this.
Thank you.
Did anyone else want to add anything?
No, I think that's good. I'll just add, we did think about applying for Maine Housing's funding for this, which would have been great, but the timing of it was that had to be applied for by February 24th, and we didn't have an option for a lease at that time, so we couldn't go ahead. But we were in conversation with Greg Payne and Maine Housing about the need, and so they're aware of it.
Very good. I think Commissioner Watonis has a question.
I have some real concerns on this, and it goes back to what Jim says, and regarding, to the staffing, to the parking down there, to we're visiting with people, because if I remember right, that parking lot is very small. And I'm assuming it's with the dirt road we're parking, or is it out front? With the dirt road?
The dirt road.
Which, there are times that road is used, with different events and stuff, like, for drug take back, for shredding and all of that. And I really don't think that this is the this is the place for something like this because of the jail there. The people that are coming in and out, you've got the LEC there, so you've got those cars coming in and out, you've got the parking. And I think that we need to really, consider, with what we will put in there. And we did get another request, for the use of that, our building, correct, Jim?
Yes.
Correct me if I'm wrong. And I think that we really, as commissioners and the county, but that we need to really think with what we want to go in there for what that was originally we used for. And I think, in all fairness to everybody, that we need to consider, is all the options. And maybe we need to put out, an RFP, to see what's out there. But I think this is something that the commissioners are really going to have, to look into, to really see if that's what we want to go into that, our building. And, you've got expenses, you've got damages that, can happen, and I just think, that we need to spend, a lot more time to consider, with what we're going to do with that, our building, and look into the other requests. So, that's where I stand on it, so.
Any comments or responsive?
Yes, I mean, I thank you for that, and I agree, it's not the perfect solution for the crisis, but it is one, and it's an opportunity to partner for it with a real urgent need, and it's not forever. So we have, we understand that Sheriff Joyce may have need for that building, which is why it's a temporary in nature. It's a building that hasn't been utilized for a number of years. It's an opportunity. It's near, for us, and talking with our mother-led households, the majority of asylum-seeking women are mother-led households. The location, even though it is next to the jail, if you come out of that building, you don't even see the jail. You come out, you see Congress Street, you see Maine Medical Center, you see the backside of Save-A-Lot, which is where it's a very popular spot to shop if you're an immigrant refugee here in Portland. There's laundry right there. It's walkable. You can hop on a bus. You can get around. You can get to social services. It's actually a great location. And we've analyzed all of that together with some of the folks that we are serving in our programs together. So we do understand that, and we think we've come with an urgent problem, asking for an urgent action in a collaborative nature. And we understand if you want to take more time and figure out sort of a long-term solution to this building, and I think that's very important for this, the county commissioners to do. I think it's very, very important. But we're asking for something very short-term to meet an urgent need.
Jim, can you talk about, with that other request, or no?
I think that's a whole separate,
Okay,
if the commissioners
gotcha.
want to take up that request, that would be another.
Okay.
We've got a letter, but we haven't gone past that letter only because we had this workshop
Okay.
scheduled.
Yeah.
And just for the Hope House people, this is our workshop, so we wouldn't have been taking a vote tonight to determine funding, no funding, what we're going to do. We can recommend it for another workshop. We can put it on our agenda for our next meeting. So it'll be an ongoing consideration. Yes, go ahead, Patty.
One final question, just for clarification, to make sure I understand. This is, I heard a short-term need, an urgent need. What is the actual time frame? What does short-term mean? Are we talking 6 months? Are we talking?
So for the patient, it's short-term.
Yes.
Yeah, it could be for them a few days, a few weeks. We have requested, which is in the documents, at least we would prefer a 2-year lease. Just 1 year would be fine. But just because of the startup expenses and time that would go into this, and we would be ready to we would be ready in fairly short notice to vacate, and our plan and intent would be to leave the space how we found it. I just wanted to two things. The Maine Health folks just got information about one of your questions, which is 250 births a year are to immigrants. Did I get that right?
Is that
Is
just
that Greater
Portland?
Portland?
At Maine Med.
At Maine Med.
8% of
At Maine.
deliveries between 2020 and 2021 were to non-English speaking patients that they categorized into immigrant status,
Okay.
which is how the system does it. So that's about 500 of a total of 6,192.
Can I ask how many of those would be asylum seekers, the mothers?
I can pose that question.
I just also wanted to speak to the parking issue. My building does not have parking at all, not one parking spot. I've gotten a lot of tickets, even though I get support from the city of Portland. I pay a lot of tickets. We move around. There's a parking garage a couple of blocks away. There is other parking, and our staff members can certainly walk a few blocks. And some will probably even arrive by bus, and those who do come to visit, most would probably be walking or coming by bus. So I think I understand there's a lot of concerns and a lot to think about, but the parking issue, I think, is one that we can manage, and especially if there are days where something's going on, and you say, this is happening on the property. Please ask your staff to park elsewhere. For this day, that's manageable from my perspective.
Go ahead, Jim, again.
I don't need an answer for this tonight by any means, of course, but just following up with Commissioner Smith's questions, it would be helpful, very helpful for me to understand if I can easily recognize this is an emergency, and frankly, if you got 250 births a year and no place to sleep, that's almost hard to imagine. But it would be helpful to know whether there is either a plan in place or a plan in at least the infant stage of being developed that's going to do something better than this building. Because frankly, I've thought from day one that we're out over our skis a little bit, thinking of this place as a good place for respite next to a county jail and a law enforcement operation. And frankly, the Department of Corrections, I think, has got their eyes on the place from time to time. It's just knowing how soon the emergency will have a plan to go with it would be pretty good to know.
And we agree with everything you're saying, and we've been advocating at the state level and everywhere we can to really raise this issue up and not providing. So what we know is that it really is cheaper to the taxpayers to provide housing for folks than homelessness, right? And then living in shelters and utilizing emergency rooms and things like that. And so we know that that's true. And so how do we move this forward? And what I've seen just personally of how things get done is you do have a project and it's small in nature, but you prove it works. And the location is perfect for this population. It's not ideal in that it's a county facility, but we've tried to solve for all of the concerns that the county would have around damage to the building and liability and risk and indemnification, in that we would take it all on. So there would be none of that for the county to address. We would take over the management of the residents who are there. We would work in close collaboration with our medical partners. We would rely on the medical partners to make referrals for short-term respite, and then we would work very closely on moving folks out. So again, it's not the perfect solution. They say don't let perfect, be the enemy of good. I think that applies here, and I'll just leave with that. Thank you.
Sheriff Joyce, do you have any comments or input, since this is right in your neck of the woods?
Most of the comments the county manager brought my concerns. I don't want to underestimate the fact that it is on a jail facility. The fact that you do go out the front door and you don't see the jail is good, but we have traffic coming 24 hours a day, so they have to be expecting that there's a lot of activity there. We have people that are being released all times of the night with mental illness and sometimes intoxicated. And when we were running the Community Correction Center, sometimes we had people knocking on the door or windows of the facility just because they knew people were in there. In some cases, they were girlfriends, boyfriends, connections there. So I would just say that the security part, or somebody being there, has got to be there. You know, it's a roof over somebody's head, it's warmth, et cetera, but it's not the Ritz-Carlton. I'm concerned about the medical part, in that at 2 in the morning on a Saturday, I can't guarantee if there's nobody there to call for help that they're going to get what they need. I mean, some of these folks are new to Portland, and, you know, even if they call, I'm not sure they're going to know where they are. So I think it's important 24/7. I didn't get that from the arrangement, and that's kind of a concern of mine. I know that the jail is behind, but, you know, with their duties, nobody's going to be responding to help them out. So I don't want to be on the hook for that. It's not that we, you know, Monday through Friday, somebody's at the LEC, we would help out, but it's the off hours I'm very concerned about. The parking, you know, I think that we've talked about that as long as they're on the dirt road. Visits, we can't imagine what the visits are, but again, a lot of cars coming and going at various times. So, you know, I do like the fact that it says 1 year. My concern, though, is we're not ready to open up as a community correction center, both in staffing and both in the availability of inmates. I don't know when that occurs, but if it were to occur 2-3 years out, I would hope we wouldn't get into a public concern of eviction, these folks. Hey, you've been here 3 years, now we want to open it up. You know, I think we'd want some language in there so that, you know, I think we've seen through the news of some of the hotels wanting to get rid of some of the unhoused, and that becomes an issue. So really, those are the only issues per se. I mean, it is a building that could help out with some of the social issues that we're seeing throughout the city of Portland. Finding that right person to go in there for a short period of time is really a challenge. And I will end on this. There is something about, I understand they're newborns, so they're probably not going to realize that they, you know, stayed on the property of a jail. But I know when we were looking at Portland's homeless, there were a lot of emails on stereotyping homeless with the jail because it was on the property and stuff like that. So it seems like these folks have kind of wrapped their head around that. But if you have a child, and I don't know if they're going to have children as well as newborns, I am concerned about that stereotype of, you know, a child realizing that they were on a jail facility, if you will. But again, there's a need. I would just say that we need to proceed cautiously. Thank you.
Thank you, Kevin.
Thank you.
Commissioners, any follow-up questions or comments? Yeah, so.
Sorry,
Ryan.
yes, I apologize. I just realized I can pseudo-answer Commissioner Cloutier's question. I believe you sort of asked about like a bigger picture approach in terms of longer-term solutions. Really, the only way that I can summarize it is a large part of what I do in my role at Maine Health is around advocacy when it comes to healthcare. I don't specifically work in Augusta. I work under the government affairs umbrella, so I have coworkers who work in Augusta. So far, that's really been, you know, the only other outlet. I focus more on the local stuff. For example, you know, this absolutely rose to the occasion in terms of a profound need. I was hopping on calls beginning in December, pretty much up and through a couple of weeks ago, just to put it in perspective with many folks at the City of Portland's Health and Human Services Department, Greater Portland Health, Opportunity Alliance, Prosperity Maine, Northern Lights, Maine Immigrant Rights Coalition, and Preble Street, Cross Cultural Community Services, pretty much every nonprofit around. We've consistently been meeting as a group to try to address specifically asylum-seeking, refugee, pregnant and postpartum women. And at least since I've been a part of those calls, and also, you know, folks from DHHS, this has been the only project that I have had the opportunity to advocate for. So it's something that is an absolute, obviously that's no secret at this point, a profound need. However, amongst all of those folks in the Brain Trust, this is the only opportunity where I'm actually seeing a project that could potentially come to fruition that would be able to address this specific demographic. The last anecdote is the last time I spoke to Kristen Dow, not to put words in her mouth, who is the head of HHS of the city of Portland. She was letting me know that, and we were talking about this specifically, she was on the phone every single day with Motel 6 because that was the only hotel motel in the city of Portland that was currently accepting GA. They were rotating a few rooms just because she wanted to call and reserve every single room if there was the opportunity for pregnant and or postpartum women at the city of Portland's homeless shelter. So it was quite literally a part of her daily schedule was to call and say, are you going to have an open room because I have a pregnant postpartum woman who needs that space. So again, a pseudo attempt to answer. Unfortunately, it's not a silver bullet, but all I can say is there's a whole lot of folks who are interested in addressing this, and again, this is the only opportunity that I've had the opportunity to advocate for. So,
Thank you, Brian.
thank you.
Staff, any questions or comments? Commissioners? Go ahead, Jim.
I just say, when I hear that there's 250 children born each year whose mother may have crossed the Rio Grande recently or caught a bus out of Florida, those children are citizens of the United States, and they have rights that need to be dealt with on a much more aggressive basis than I think I'm seeing right now. So, that's my observation. I really hadn't thought about, I knew the asylum adjudication system was very lengthy and not very helpful, especially in New England, but I really hadn't focused on the fact that so many citizens were likely to be abused by this process. It's not, I think it's completely unacceptable, and Brian just talked about the coalition of the willing here that sounds like it has to meet in the Civic Center, but the one group that didn't seem to make an appearance was anybody from the government, and the government is where the resources are. It's just an observation. That's it.
All right, thank you very much for your presentation, your input, and insight. We will take this up either at our April meeting, or we'll schedule another workshop and reach out to you if we need additional information. Thank you.
Thank you. Is there anything that you'd like for staff to be prepared for?
Is there any additional
Is there
information?
interest in the other letter that we received,
Oh, I
or would you
think-
like to
yeah.
focus in on this for the
All
time
options
being?
should be on the table.
I think
Jim,
all
I think.
options need to be looked at this time, because, we just can't say, well, yes, well, this is right, but this one, could. So I think that we need to maybe schedule and have a discussion on the other option.
Jim Cludier, your comments?
I don't question for a minute that we're out over our skis here.
Right.
If there's any use that we can make of this, and it seems to me like it's gotta be a one-year deal and that's it.
Right.
But, we should know what everybody else thinks they're gonna do. The impression is that maybe the state approach to correctional activity is such that the Community Corrections Center may be a thing of the past. We don't know. We'll have to figure that out, too.
I think there's some concern, Kevin expressed it, and I share some of that, that if we commit to this, it's a very worthwhile, very needed emergency, frankly. But if we say a year only, it's not going to be easy to disrupt and to dislocate these people after a year. And there are political consequences for that, and there are real consequences for that, for us and more importantly for them, in terms of that. So before we commit to a project that's a year, and I can't imagine that the solution would be found within a year, I think we have to be very, very careful and sensitive to all the issues.
And the next shoe to fall could very well be trying to actually create something that would be worthwhile over the long term, you know.
Right.
And
Right.
I've said it before, I'll say it again, dealing with housing shortages in southern Maine is like, you know, so far all the solutions are like spitting in the ocean. They're nowhere near close to what is actually needed.
So, should we schedule something in April, you know, and to talk about the other one, the letter of
Jim,
interest?
can you,
Can we do that after the next meeting?
yeah,
Just a
reach out and
quick
get resources?
workshop?
That should be a workshop again, though, shouldn't it? If it's-
Or
Yeah.
maybe just a circulation of whatever
Right.
we're able to come up with. We might not have a lot to talk about within a couple of 3 weeks.
Well, the other thing we could do, depending on the length of the April meeting, is schedule a short workshop that day. If
Now,
we
remember,
have the
Jim and I
information.
aren't at the April meeting.
No, Jim is here the
No,
week
he's-
of the 10th.
He isn't.
But that Jim's not.
That's right, Alex will be here.
Absolutely, Alex can.
Right.
You're gonna make me come in for that?
Who, what? No, I mean, so, even, I don't think we should wait till May if Jim acquires the information and have a short workshop and at least move the issue again forward. Because if we have an option to, viable option, another viable option to fill that facility, then we should consider it.
I wish they hadn't left. It seemed like they jumped out of here awful quick. One of the questions I have for the commissioners are your thoughts on, you got the pre- and postpartum asylum seekers, but they also, as of last week, brought in the other respite care.
Yeah,
That,
they
you
really
know-
tried to downplay that.
They did.
Yeah.
Yeah, but it could be backfilling a lot of the beds if they're not putting
Right.
pre and post asylum seekers in there. So I guess my question is, I'm seeing that would have more generation of traffic, more parking required and so is it the commissioner's desires to keep both, or would you rather just focus on asylum seekers if you're going down this road? I guess that would play into my discussions moving forward with the applicants.
Well, the issue I have on that, if they will backfill those beds, okay, and they will backfill them all, and then we get a pregnant one, well, that needs a bed, well, then what are you gonna do? So you've defeated with why you've opened that up. If you can, I will house them because you've backfilled of the beds because the beds are there. I would like, you know, that if we go that route, which I'm really not in favor of, because there's just too many obstacles, well, for me, is we keep it what they originally wanted it to be. Because if you start getting into, you know, part of this and part of that, and the next thing you've lost, you know, with why you've really opened that up.
The average
I agree
is
with
five,
that. I
five
agree.
live births
Yeah.
a week.
Yeah, so,
Right, I would agree too.
yeah.
So
You gonna agree with me, Jim?
it's a real approach avoidance situation, as the psychologists say. It might be a double approach avoidance.
It's getting scary, my
Oh,
last
it's pretty bad.
year and a half.
Anything further, Jim?
No, thank you.
Okay, very good.
Okay.
All right, our next item on the workshop is the presentation of hiring practice from the sheriff and other parties.
So, the last 2 weeks, HR has worked with my staff to try to cut down what I call the ping pong ball of going back and forth over the hiring process down to maybe potentially cutting the hiring process in half. And I told Amy that I would let her and her staff go over it and share the good news, if there's any. and we'll go from there.
Very good. Amy?
Handed out packets, and I think it's always good to know where we started, the steps in which we started from. So we have a current applicant tracking system called JAZZ that allows us to document each step of the hiring process, in addition to showing the length of time in each step of that process. So this is for the first page of your packet is the current correction officer hiring process from October of 2022 to date. And as you go through each step of the process, and also with each of these steps, there are certain components that you're waiting for the candidate to respond with documents, with questionnaires and things like that. And so I think it's important to realize that on average, it's taking 75 days from the point of the person applying to get someone at the end of the last step. The second page of your packet really shows the progression of how many people we started with to how many we end with. So during this period of time, 75 outside candidates applied for this position. And through each step, you'll see how the numbers decline. And some of which, particularly like in the interview requesting, conditional offer, we do screen some people out of that initial interview based on the answers they give us, if they're not interested in shift work, if they can't work overtime, if they have some basic criminal record that they do divulge to us. We do screen people out. However, of those candidates, at the end of that, we do give them the personal history questionnaire. And as you can see, we did distribute 36 and only 22 responded with that questionnaire. The next step goes to reference checking and background checking. So that went down to 19 candidates. The polygraph questionnaire we gave to, and when you see a decline, it's either they didn't respond or they were taken out of the process because of their background that they disclosed. The next step is the polygraph questionnaire that was sent. We're down to 14. 9 completed it and returned it to us. We had 4 didn't pass the polygraph, 5 did. Then you go to the post-offer physical. You see that 2 passed the post-offer physical, 2 did not, because they couldn't meet the physical requirements of the job. And then I think it's important to note that even when you get down to 2 candidates that we have gotten through this process, our retention rate for these hires, it's still at a 60%. That we even retain these people, and we'll talk about that in a little bit. The sheriff, the chief deputy, and members of his staff have looked at ways that we can look to improve the processes that we have under our control. And what was significant in terms of timing was reference checking, background checking, and polygraph, if you see the higher numbers. So one of the things that we agreed to consider as part of this process is to integrate the personal history questionnaire in with the initial interviews as part of the whole process. So take out some of that mailing component of people responding and integrate that into the hiring process on the front end. And then in addition to that, so we'd have some continued overlap, we would give that candidate the polygraph questionnaire at that step, really educating them that this is contingent on, to get to the poly, you have to get past the reference and background checking, but at least they have that in hand so that they could start working on that document. I did add a few more days into that first step because of the, more of our hands-on of asking that personal history questionnaire and building that into that first step of the process. The Sheriff's Department has committed to reference checking and background checking to 3 days. And some of that is, you've got a weekend sometimes when you build into this, this is not based on work days, but calendar days. So if we do get that information back on a Friday, they can't really do anything on a standard work week until that Monday. And then the next thing is the polygraph, and this is significant. It was reduced from an average of 30 days to get a polygraph. They've committed to bringing that down to a week, not only using internal resources, but also outside providers to expedite that step. And lastly, the job offer, and then again, the physical exam is really contingent on the candidate's schedule, if they're currently working, and of course, our occupational health provider, and that turnaround. We are going to start including the drug screen as part of the post-offer physical. The last step is really what we were trying to target in our discussions, was reducing the personal history questionnaire from 40 pages to less than 8. And the reason behind the 8 is currently, in an effort to get people to our door to even speak with them during the interview, we have reduced our job application to a small page. We don't include work history, job references, and any military history. So that will also be included as part of the personal history questionnaire. So that's why it's going to be 8 to 10 pages, because 4 of those pages are going to be job history, educational history. The other thing that we have found is that we've had a lot of people's hands in the process, and sometimes that does delay a hiring process. So we've really reduced and identified points of contact, not only within HR, but in the sheriff's office. And again, like I said, we've significantly reduced the time of each step in the process that we have control over. And the drug screens. We were planning on giving you a copy of the PHQ this evening. We're still in the process of working on that and coming to an agreement, and our hopes to have that done by the end of this week.
Very good. Questions from the commissioners first? Go ahead, Jim.
I guess for you or anyone else who wants to answer or can answer. First of all, I think this is great, and it's something that we definitely want to be committed to for a period of time, but the flip side is our time is short. I mean, I spitballed the idea that come May, June, the circumstances are going to be such down there at the jail that, you know, people are going to want to go on vacation, people are going to be entitled to do a variety of things. We probably need another, somehow, 15 or so corrections officers just to get through the summer without any people leaving. And we know we've got people who are entitled to leave and might decide that they have a different life to lead after June, you know. So I've been trying to think, and I would love to have your reaction to this. If we assume we put a 60-day time frame on at least getting some feel for how this works, can we also consider or try to evaluate what outcomes we think would be the minimum that we would have to see before we would not take additional action of some kind? That's the, I mean, it's.
I understand.
It's a dire thing, but, and I hate to even think about it, but, at some point we're forced to it.
Yeah. So I'll use the example of where we were 2 weeks ago. We had 8 candidates within the polygraph process. 4 have passed. 2 are in the occupational health provider post-offer physical step, and 2 have been hired. 3 didn't pass the polygraph, and 1 is waiting for a polygraph to be scheduled. We currently have, between the conditional offer, and that's the beginning, and the reference checking, the beginning part of the process, 1 is in background, 1 is waiting, we're waiting for their polygraph questionnaire to be returned, and we have 2 waiting for a polygraph. So potentially, by May Academy, and that's kind of the goal, is to hit the May Academy, we may have up to maybe 7 or 8 into that May Academy if all of this goes as it's trending right now. As for 15, we're not going to hit 15. And even when they're in the May Academy, they're still new, and they have to go through the academy, and then they have to come into the jail and do their field training with the FTOs. So, and I'll have the jail speak to some things that they are looking to do to fill those gaps. We are in the process of considering some MOAs for changes within the jail, but in terms of operations, I can't speak to that.
I understand.
So to clarify, out of the 4, correct me if I'm wrong, Chief, 2 is certified, 1's certified in the state of Maine, and we'll be starting, so that should be pretty easy. The second one, we had a polygraph done in Florida rather than make them drive up or fly up. So we're trying to now navigate how he gets his medical evaluation. He's pretty committed to coming up here, so that part of it, we'll have to find out whether the academy makes him go through part of the corrections academy, or if they just waive it where he's certified down in Florida. So there's at least 1 that will hit the floor with field training immediately, does not have to go to the academy. The second one we're going to try to figure out. We also have an individual that just started last Monday, that he's been a corrections officer in North Carolina, in California, been a pseudo police officer in Florida. So we're trying to find out if any of his training will convert over, or do we have to send him to the academy. So there's a potential of 3 that might not have to attend the academy fully, and we can kind of get them on to the floors. But again, that's all dependent on the academy. So did I cover everything? So.
Amy, any follow-up or to that?
No.
Questions, commissioners? Go ahead, Patty.
Thank you very much. Nice to see the teamwork. Nice to see, putting heads together, trying to figure out what we can do to create a better path forward. So I'm really happy to see that. I appreciate the efforts on everyone's part there. I just have one quick question about when you asked that they send their polygraph question back. I'm just get the wording right. Do they have this piece of paper that they fill out at home and send back through the mail?
No. We have that all as part of the applicant tracking system. It's all done electronically. We
Okay.
have it in fillable forms.
Great.
So they can do it at home from their computer, and then it's emailed.
Okay, I missed the part where you said you missed some things coming back and forth in the mail. Did I
I
not
meant
hear you?
email.
Oh, okay, all right. I was like, well, I don't know how old
It's
school it
email.
might be, you know what I mean?
It's email.
Okay, it's email, great, okay, thank you. No, I think it's great, and I want to just add one quick thing besides the great, better teamwork, is that I think reviewing it after 6 months is really great, to see where we're at. And the way you put it out in terms of what we're doing differently, we can isolate each area. So now, after 6 months of data, we can see maybe which specific contributing factor is still a bottleneck for us, or is doing great, or we see the outcome. So I like the way it's set up so that we can really review progress. And I actually would be in favor of, for the next 2 years, 6 months, 6 months, 6 months. Not that we have to see each other, but a report comes at the 6-month mark every 6 months for the next 2 years, because we know that the hole is so large, we won't get out of it in 6 months, as we all heard. But in 2 years, I'd love to see a goal that in 2 years, we have added, and we haven't lost anyone, unnecessarily. I think that would be just a really great thing to track and a good thing to shoot for.
Yeah. I'd also like to, our goal is to review this. You have to have the number of applicants to
Yeah.
make sure it's a valid, group of what you're looking at. We're going to probably look at it after we get in, the whole new system still needs to be updated and changed within the applicant tracking system. And then I have to set up with the Bayside about the post offer. So there's some work that we need to do if we can agree to the personal history questionnaire. But my goal is to meet and review the data every 60 days, and then perhaps with you guys, you all, in 6 months is fine. But if we still start seeing those creeping delays, we would go back and revisit that so that we can have consistent change and continuous improvement if we find other opportunities to change this hiring process to expedite it.
Yeah, I don't think we can.
Fabulous.
Yeah, I don't think we can wait 6
Yeah,
months.
Right, great.
Yeah.
I kind of agree that we ought to, maybe 6 months looks good a year from now, but.
I think I meant to say something different.
yeah,
It could be the
that's all
cold
right.
medicine.
Okay.
I meant to say 6 weeks, I'm sorry.
Okay.
All right, so,
Whatever, yeah.
yeah, I think we gotta give them a couple of months to,
Yeah.
60 days.
because iron out some kinks and that kind of
Okay,
stuff. But
good.
the other aspect of this, which is kind of, it's gonna eventually drive our process, is what are we gonna have for a county jail in a year or two? Are we going to have 250 inmates? Are there gonna be any federal inmates in there? We get to choose whether that's gonna be true. What's the budget like? We're budgeting now for 450 or 500 inmates. There's nothing close to that there. Our operations changes are probably not reflecting the change in census, for instance. And the change in census has external impacts, as I'm sure the sheriff would be very quick to point out, with various police departments across the county and the LEC operation. So I think we've got some depth of field that we have to address before we're very far into this. But and I don't know how we go about doing that, because 3 weeks ago, we had the Attorney General, the District Attorney in here, who frankly pointed out that as open-minded as we are in Maine about keeping our incarceration rates low, it's still 4 times what exists in Western Europe, at least according to her. So I assume she doesn't say that without some basis. But, the question is, what does Cumberland County have to have, and what should it have for incarceration capacity? I assume we're still pounding ahead on the medical facility that had been planned, and that's an important addition to our capacities for sure. So I don't know. So I think maybe one of the things we have to do over the next few weeks, months, is design a process to start evaluating how and what that is going to be. And that's really very much a policy question, I think. So, and probably one that the Department of Corrections thinks they need to tell us what to do, but, we haven't listened to them yet, so why would we start now?
For a good reason.
Can I respond to a
Yes.
comment from Commissioner Smith? So one thing on the polygraph questionnaire, we're giving that to them after they
Yep.
interview, trying to encapsulate, kind of push everything together, if you will. But we're also setting a deadline, not a hard deadline, but a deadline, to get that questionnaire in within 48 hours.
Great.
The hope is that if they follow it, then we could really move things along.
Yeah.
But if they don't, that doesn't mean we're going to nix them. I mean, hopefully some will follow and we can get them set up for polygraphs within a week or so. of getting their application, and then any stragglers we can kind of work in after that. So that's the other thing that we decided that Amy did not mention. So kind of keeping them on task, because unfortunately the old way is you do one thing, you ask them to do something, we all get distracted with things, we'll do it tomorrow, tomorrow becomes next week type thing. So we're trying to focus them into, if you want this, let's try to push you along. So.
Yeah, fast track sounds great, and I think it's great that you're really putting out a emphasis on 48 hours, because that's probably going to your better employees that you're gonna hire, is someone who's following a command, following a deadline. You know, those are just good signs of good employees, so, good.
So has this been done?
It's gonna be finished, it's gonna be 8 to 10 pieces. Other questions or comments from the commissioners? Other input from the staff? No, okay, I was waiting for the head nod. Don, did you have a comment? Anyone else from the sheriff's office? So, again, great work, everybody, as a collaborative, cooperative solution to the problem. Hopefully, we'll get more applications as we streamline this to less than 35 days, because there's a lot of time built in on the poly. People really want the job, maybe they'll respond in 5 or 3 or 2. And gives us a 2-month window to get some more bodies in there and give you some relief in terms of scheduling, a little bit, at least, baby steps, but it's helpful.
If the commissioners would like, we can update the commissioners at the April 10th meeting concerning the questionnaire that's being worked on right now. That's kind of like the missing piece in our discussion this evening. And as Amy spelled out, it's a working document that's hopefully going to be between 8 and 10 pages. But maybe right at the beginning of the meeting during informational reports, we can just update the commissioners on what that document looks like.
Great.
Can I just ask this, is that an online, you know, the little blue bar name, blue bar this? Maybe if we can have that link so that we can
We'll fill it out.
test drive it, yeah.
All right.
Yeah, Kevin.
So we kind of wrap that questionnaire into, after the interview or during the interview, asking some questions. I mean, we took it from 40 pages or whatever, which we found out was kind of the history behind it in the last 2 weeks was that this was something that was developed back in the early 2000s-ish when the academy wanted to upgrade law enforcement certification and stuff, so they created this questionnaire and then the polygraph. Polygraph's got to stay the same. We found out we can change this. So what we've tried to do is pare it down, and there's 2 philosophies, and that's where there might be 2. You know, if you take a lateral certified person, you probably want to ask about, have you ever perjured yourself or written down something in a report that wasn't true and stuff. For somebody coming off the street, we've pared it down to, hey, instead of 20 categories of drugs, have you ever used drugs, and what were they? You know, one question. You know, have you ever stolen pencils from your employer or something like that? Have you ever stolen anything from somewhere? And let them explain. So this is more of an interactive type thing. And then the other thing is when that's interactive, to actually tell the candidate, look, you know, the next step will be a polygraph. And the bottom line is that we're not perfect. Nobody's perfect. If you've done something, just tell the truth. And kind of take care of the fears as going back and forth rather than sending out this 40-page document, one of 2 that you're going to have to do and letting the person kind of waffle. So I think that's another key point that we've kind of done is tried to point it to what do we really need to know going into it that maybe the person has done something that we don't want to waste any more time on. At that point, we would remove them from the process. But if it's something that, you know, I shoplifted 20 years ago, that's not going to be a big deal, you know. Just tell the truth when it comes time type thing. So that's kind of the other thing that I think maybe we didn't relay out as well as we could have tonight, so.
Thank you, Kevin.
The key is that at 8 to 10, because you don't want the applicant to say, I'm not filling out gigantic paperwork.
But that's,
So-
8 to 10 is manageable.
Yeah, and the thought behind that is the portion that they'd be completing is their work history, their military history. That's the part that they need to return. We'll be integrating that personal history questionnaire. We'll be asking that in HR. That'll be a verbal question that we'll be going through after they've gone through the initial. We've given them that preliminary offer letter that allows us to ask those next level questions. And we'll be doing that in HR.
Thank you. Okay. So,
I'd like to make a motion. Go into
Yes.
I'd like to make a motion to go into executive session, Title 1 MSRA, Section 405, 6D, discussion of labor contract and proposal and meetings between the county, Cumberland County and NCEU and Teamsters leadership.
do I have a second?
Second.
All those in favor?
Aye.
We're in executive session, and we won't be coming back since this is a workshop, so for you folks who are watching this, thank you. And our next meeting is April 10th, 5:30.
Now, will we go out of this room?
Yes, down in my office.